Let's talk about hymens. Have you found it really impossible to put a tampon in? Or sometimes you're able to put a tampon in, but it's excruciatingly painful to take it out. You're not on your own. You could have an issue with your hymen. Lots and lots of women have different shaped hymens. For some women, there is a little septum, which is just like a little band of tissue down the middle. So you could have an opening either side. One might be slightly bigger than the other, and that way you can get perhaps a tampon in, but have it really difficult to get out. The other issue is it's extremely difficult and or extremely painful to have intercourse. First of all, you're not abnormal. This is quite common, and I would have a lot of young women that come to my clinic for this reason. This is what we call a hymenal septum. If you think that this is you do need to have an assessment, you do need an examination, and it's really, really easily treated. I bring women in all the time, usually in teenage years, and I give you a light anesthetic, and then it's just a tiny little incision into the vagina to cut this little area out, and you'll have no problem having intercourse and putting a tampon in. Another issue in relation to the hymen is what we call an imperforate hymen. Now that's a lot less common, but what that means is that the hymen is completely closed with fibrous tissue, and intercourse is impossible, but also having a period is also impossible, in that you may have all the symptoms of having periods. You might have the breast tenderness, you might have the bloatedness, you might have severe pain during that time. It happens for a few days a month, but you're not actually having a visible period, and you've never had a period. So that way you do need to come to a gynecologist, you do need to have an ultrasound scan done, and you do need to have an incision of the hymen under an anaesthetic. Again, it's a tiny little nick incision, but it cures the problem, and then you'll have your periods. And this is what we call an imperforate hymen, and also what we call retrograde menstruation, meaning that the period isn't getting away and it's being pushed up into your womb. So if you're having any of these issues, contact us if you have any concerns at all, and we're here to help.